Right now, as you sit and listen to this, your heart is aging on a clock you have never been shown. For more than 60 years, doctors have measured your heart risk over the next 10 years, and that one decision has been quietly hiding the next 20. Every morning after the age of 60, your arteries, your rhythm, and your circulation are drifting along a 30-year trajectory that the standard heart risk test does not even look at. It is happening today, it happened yesterday, it will happen tomorrow. By the time most people notice the first warning sign, the damage is not years away, it is already in motion. And there are 5 of these signs your body has probably been showing you for months. In the next 18 minutes, I am going to walk you through every one of them. By the time we get to the 5th sign, you will know which of these is the one I lose the most sleep over, and why almost no doctor is saying it out loud. I am Dr. Richard James. I have spent more than 3 decades helping older adults understand what their hearts are telling them, long before the symptoms become an emergency. The way we measure heart risk after 60 changed in late 2023, and most of the patients I see still have not been told about it. For most of the last 20 years, cardiovascular risk for adults over 60 was calculated on a 10-year horizon. The tool was the pooled cohort equations, and it was the workhorse of every cardiology clinic. In November 2023, the American Heart Association introduced a new tool called Prevent. For the first time, Prevent projects 30-year cardiovascular risk, and it includes kidney function and metabolic markers the older calculator did not even ask about. That single change matters more than almost any new medication released in the last decade. A 64-year-old who looks low risk over the next 10 years can carry a substantially higher score over the next 30. And most of the warning signs the 10-year test never asked about are signs you are already feeling. This is not a normal part of aging. By the time most adults notice the first sign, a meaningful share of the damage is already in motion. So the question I want you to keep in mind is, why has your doctor probably still been using a tool that only looks at the next 10 years? Picture a patient I will call Helen, the kind of profile we see in clinic every week. Helen is 68, a retired math teacher, 2 daughters, 3 grandchildren, married 42 years. She came in last spring for a routine physical with a 10-year risk score that looked perfectly clean. Same blood pressure she had carried for a decade, same labs. But on the new 30-year horizon, her risk was not reassuring at all. And the first 3 signs we are about to walk through, she had been quietly ignoring 2 of them for over a year. Sign number 1 is something almost every person over 60 has noticed, and almost every person over 60 has dismissed. You wake up and you are not rested the way you used to be. Not exhausted, not drained, just not refreshed. The coffee tastes the same, the room is the same, but the morning takes longer to land in your body than it did 5 years ago. That dismissal is exactly the mistake we need to fix today. The gap between when you open your eyes and when you actually feel ready for the day has a name. Cardiologists call it heart rate recovery. In adults over 60, a slowing morning recovery is one of the earliest signals of arterial stiffening. Here is the part most doctors do not take the time to explain. Overnight, your blood pressure is supposed to dip. Your heart slows. Your arteries soften. Your kidneys trim the fluid load you carried during the day. When all of that works the way it should, you wake up with a system that has been quietly serviced for 8 hours. When that nightly reset stops working, you do not feel a heart attack. You feel a slow morning. You blame the mattress, or the weather, or your age. The data here is not subtle. A 2024 review in the journal Hypertension reported that the proportion of adults over 60 whose overnight blood pressure stops dipping the way it used to is significantly higher than most cardiology guidelines have historically assumed. Every one of those non-dipping nights is a small acceleration on the same 30-year curve. This is what quietly accelerating actually looks like. It does not look like a hospital. It looks like a Tuesday morning. That brings us to sign number 2, the stairs. The same stairs you have climbed 1,000 times. The flight in your home, or at the grocery store, or up to your daughter's front porch. There is a small new pressure in your chest when you reach the top. A breath you did not used to have to take. A pause at the railing that you would have walked right through 5 years ago. Most people call that aging. It is not. A new breathlessness on a flight of stairs you have always managed is one of the cleanest early markers of left ventricular function changes the 10-year calculator never asked about. Your heart is not failing. Your heart is reporting, and the report is being ignored. Think about what the stairs are actually testing. A short flight of steps is, biologically, a 90-second cardiovascular stress test you give yourself for free every single day. The body has to raise heart rate, expand stroke volume, redirect blood from the gut to the legs, and recover all of it in about 2 minutes. When any one of those systems is drifting on a 30-year arc, that 2-minute test is the first place it shows. Long before a treadmill in a clinic, long before a stress echo, long before any number on a 10-year score moves in the wrong direction. The reason the 10-year heart test never caught either of these is simple. It was never built to ask about them. The pooled cohort equations were designed to estimate the probability of a cardiac event inside 10 years using cholesterol, blood pressure, smoking status, and diabetes. That is it. Prevent was built around a different question. Not, will you have an event by age 70, but what is the trajectory of your cardiovascular system across the next 3 decades? That is the gap we are closing today. Now here is where it gets really interesting. The next 2 signs are not even in the same part of your body. They are the ones most people misread as something completely unrelated to the heart. Sign number 3 is the rhythm you have been blaming on a long day. Those flutters when you are falling asleep. That strange awareness of your own heartbeat at 4 in the morning. The skip you felt halfway through dinner that you decided was just stress. Most people do not connect any of that to the heart. They connect it to coffee, or a bad night, or the second glass of wine they had at the family dinner. Some of you are listening to this and quietly counting up the nights this has happened. The 2 a.m. flutter that woke you up last Tuesday. The half-second pause at 4:15 last Thursday morning. The thing that happened on Sunday that you decided not to mention to anyone in your family because it sounded dramatic to say out loud. None of those moments are dramatic. Each of them is data. And every one of them is the kind of data the 30-year framework was built to take seriously. Here is what is actually happening. As arterial stiffness progresses on the 30-year curve, the heart's electrical timing is one of the first systems to show wear. You do not feel a fixed arrhythmia. You feel intermittent flickers, mostly at rest, mostly at night, mostly when nothing else is competing for your attention. A 2024 review in the Journal of the American College of Cardiology described nocturnal heart rate variability as one of the strongest non-invasive predictors of long-horizon cardiovascular outcomes in adults over 60. That is exactly the variability you have been chalking up to a stressful Tuesday. Sign number 4 is in your ankles, the end-of-day swelling. The shoes that fit fine in the morning and feel tight by dinner. The sock line you noticed when you got undressed. The wedding ring that goes on at 7 in the morning and refuses to come off at 9 at night. Almost nobody connects that to a 30-year heart trajectory. They blame the salt, or the chair, or a long flight 3 weeks ago. Persistent end-of-day swelling in the lower legs is one of the earliest external markers of mild diastolic dysfunction or right-side heart strain. It does not show up on a routine ECG. It does not move your 10-year score. It moves on a 30-year curve. Helen had been wearing looser socks for over a year before anyone in any exam room asked her about it. Here is what most people do not know about that swelling. It is not random. It tracks the time of day. It tracks the heat. It tracks the salt at lunch versus the salt at dinner. The 30-year framework treats the same swelling as a signal, not a side note. That single shift in framing is the entire reason a sock line at the end of the day belongs in a cardiovascular conversation in 2026. You can run a quick check tonight. Sit on the side of the bed before you change out of your day clothes. Press a thumb gently into the bone of your shin, just above the ankle, and hold it there for 5 seconds. If the dent stays for more than a moment after you lift your thumb, that is the pattern we are talking about. It does not mean anything is wrong tonight. It means the conversation needs to happen at your next appointment. Now, this next sign is the one I lose the most sleep over. Once you see why, you will never look at a forgotten word the same way again. Sign number 5 is the cognitive slip. The moment in the middle of a sentence when the word is right there, and then it is not. The 4-second gap before your daughter's address arrives. the brief lightheadedness when you stand up from the dinner table, the fog between 3 in the afternoon and 4 that you have been calling a senior moment for the last 18 months. Most people will spend years calling this memory. It is, in fact, circulation. Your brain consumes about 20% of your blood supply every minute. When the arteries that feed it stiffen along the same 30-year arc that prevent is built to capture, the very first thing to slip is not your strength. It is one specific sentence, one specific name, one specific Tuesday afternoon. Think for a moment about what that means in practice. The brain does not have a warning light. It does not raise the alarm when its supply line stiffens by 5%. It simply does less of the thing that costs the most blood. And the most expensive thing your brain does is pull a familiar word out of long-term memory in under half a second. That is the very first task that quietly drops in quality. Not your driving, not your reading, not your reasoning. A name, a street, the title of the book your daughter mentioned at lunch. That single dropped word is the closest thing your body has to a check engine light for circulation. A growing body of imaging research, including work in the journal Hypertension and JAMA Neurology in 2023 and 2024, has linked subclinical cerebrovascular perfusion changes to early cognitive lapses in adults over 60. The pattern is consistent. Cognition slips before imaging confirms a problem. And imaging confirms a problem before any 10-year calculator catches up. Here is what makes this so dangerous. The cognitive slip does not announce itself. It does not arrive on a Monday with a label on it. It arrives on a Wednesday when you cannot remember the name of the new neighbor you met 3 months ago, and you laugh it off because everyone forgets a name. Then on a Saturday when you skip a beat at the foot of the stairs. Then on the following Tuesday when your daughter notices you have been reading the same paragraph for 4 minutes. By the time someone in your life asks the question out loud, the trajectory has already been moving for years. That is the entire reason the 30-year horizon exists. Not to scare you, to catch you 20 years earlier than the old test ever could. This is the sign I lose sleep over, because by the time it earns a name in a chart, the test that should have caught it 10 years earlier was never run. So here is exactly what I want you to do, starting at your very next appointment. There is one specific request that closes the entire 20-year gap, and I will give it to you in a moment. Now I know what some of you are thinking. Your last checkup was reassuring. Your numbers were fine. Your doctor told you to keep doing what you were doing. I am not telling you those numbers are wrong. I am telling you they are short. The 10-year score was built when 60 was an ending. The 30-year score was built because, for most of you, 60 is a middle. People over 60 today routinely live another 25 to 30 years. The horizon needs to match the life. That is the entire reason the American Heart Association extended the window. It was not a controversy. It was an update. I am not telling you to throw out your doctor's advice. I am telling you to add one specific question to your next conversation. The conversation needs to happen. Here is how that played out for Helen. Helen asked her cardiologist for the Prevent 30-year score at her very next appointment. Her numbers came back significant enough to change the rhythm of her monitoring entirely, without changing a single medication she was already taking. She did not get put on a new drug. She got put on a new schedule. More frequent blood pressure logs. A repeat lipid panel in 6 months instead of 18. A referral for a 24-hour ambulatory monitor she would never have qualified for under the 10-year framework. Once Helen had a 30-year number in front of her, she stopped explaining away the things her body had been telling her. The slow morning, the stairs at the grocery store, the 4 a.m. flicker, the ankle swelling she had blamed on a cross-country flight 14 months earlier. Each one stopped being an argument with herself and started being a data point on a curve she could actually see. The biggest behavior change is not what your doctor does. It is what you stop dismissing. That is the whole difference between the 10-year picture and the 30-year picture. It is not a different diagnosis. It is a different attention. Here is exactly what I want you to do, starting tonight. Tonight, write down which of those 5 signs you have personally noticed in the last 90 days. All 5 of them. Slow morning recovery. New breathlessness on the stairs. Nighttime rhythm flickers. End-of-day ankle swelling. Brief cognitive lapses or lightheadedness. Be honest with yourself. Do not dismiss any of them. That list is the most important page in your medical file you will ever produce on your own. This week, take that list and check it against 3 things: your current blood pressure log, your most recent labs, the date of your last cardiovascular checkup. At your next appointment, you do not need a debate. You need one sentence. Write it down. Take it with you. Can you run my 30-year cardiovascular risk using the Prevent calculator? That single sentence is the bridge between the 10-year picture you have been getting and the 30-year picture your body has been showing you. That single sentence closes a 20-year gap your last 60 years of healthcare were never built to close. If your doctor says they have not used Prevent before, that is fine. The American Heart Association posted the calculator publicly. It runs in less than 2 minutes inside any clinic computer. Ask anyway. The point is to put the next 30 years of your cardiovascular story on the same desk that the last 10 years have been sitting on. Your heart has been telling you the truth on a 30-year clock. For too long, the test we have been running has only been listening to the first 10. Now you know how to listen to the rest. If anyone in your life is over 60 and has been quietly dismissing one of these 5 signs: the morning that does not feel rested, the stairs that do not feel the same, the rhythm at 4 a.m., the ankle that swells by dinner, the word that should have been right there, share this video with them. You might never know it, but you could be the reason they ask the right question at the right appointment. Next, I am going to walk you through the BioAge AI retinal scan that is now revealing cardiovascular risk through the eyes. Because if your heart is aging on a 30-year clock, your eyes have been keeping the receipts. Stay close. Take care of your heart tonight. I am Dr. Richard James, and I am rooting for you every single step of the way.